Hi everybody, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne, on scars, and pigmentation. I do a lot with facial balancing as well. I'm going to go through some of the questions that I've been getting on social media. I thought there would be a way that I could format this and sort of highlight some of the bigger questions that I get over and over again on my comments underneath my videos. So I'll go through a couple of these ones because these are some of the bigger ones that I sort of see over and over and over again that I think probably it'll help a lot of patients if we can kind of explain just what happens when we do subcision and why sometimes you may feel like it didn't help enough. It's possible whenever we do subcision that we broke up the scar tissue, but there's still a lot of volume loss underneath there. So actually, let me lower this a little bit here for you so you can see it better. But it's possible there's a lot of volume loss. And when there's a lot of volume loss, that means that we still have to do things for volume, potentially, for example, Radiesse, Sculptra, Bellafill, all options for volume. And if you don't do that, if we break up the scar tissue and lift it up, you may not see enough of a result right there. So that's something to consider, that maybe you have to consider doing something for volume. And one of the things I always see on here for a lot of patients is when they've done these fillers, when they've done these sculptures, when they've done the procedures, it's still not enough. Well, there may be a lot of volume loss, so it's like sometimes when we place a little bit of volume in there, we don't want to put too much at one time, and you just have to wait, let it integrate with the tissue really well, and then you could place them a little bit later on and wait 3 months, 6 months, slowly build up that volume. There's a way to do it really, really softly, keep it really natural, but it's like slower than people expect. This process in general is just slower than people expect. It doesn't make sense to really kind of, I had a patient today that was doing a consultation that was asking if they could what would be the fastest way to get a response, what would be the fastest treatment that they could do for improvement for their skin. And she's of, Fitzpatrick 4, and we have to be really careful with our skin. We can't just rush this and just expect after a single session that's going to be just done and over. So there's nothing that's going to be fast. And if you rush it, it's really, you really could end up with more consequences. So actually better to go slower and try it with the skin, see if we could test out a bit of some of the areas right there, see what happens where if we do a little bit of volume, do a little bit of some of the laser to resurface, and then wait a little bit and see how it integrates with your tissue, and then before putting a little bit more in there. Hi, Mrs. Jones. How's it going? Good seeing you on as well. Hopefully you're doing well. Hopefully everybody could hear me and everything's okay from that end, because I saw some things that people were saying there was a bit of a lag. Just hopefully everything's okay there. Hi, I'm up. How's it going? Let's see here. Has anyone ever told you resemble Mark Ruffalo somewhat? No, I haven't heard that actually. That's a new one. Cam is saying, is ablative laser effective for moderate severe acne scars? How many sessions are required? I would say it's not going to help much really. Really in general, energy devices are pretty ineffective by themselves for a lot of these scars. The way we're doing it is focused energy for some of the spots along the edges of the scar, for example, but we don't want to use high heat, high energy throughout the whole face. We do it really like a blended approach. So there's a way to do this. It's not really about just using energy devices and then you just sort of call it a day, especially if you're saying it's moderate to severe scarring. It's a lot of times that takes a lot more effort and work than just doing any kind of energy device, especially now a minimally invasive procedure like ablative lasers like that. So I wouldn't really recommend that for patients. But the other thing is that when I'm talking about patients like this, they're saying, what if subcision doesn't work? Then what? We have to take a look and see, how is the subcision done? Was it done appropriately? Who did the subcision? Did they use enough numbing solution to really stretch out the scars, really go in there and actually break up the scar tissue? Do you have a lot of volume loss? Was there a lot of underlying volume loss, fat loss? Were there areas where we have to actually improve some more of the scar tissue around with lasers or peels? Are there other problems potentially that we have to look at? Maybe there's a lot of laxity around the scars, because remember I was showcasing last week where sometimes there's an anchor effect where it's basically anchored down there and it's pulled down, and we may have to do something now to actually solve that as well. And that may be where we have to go inside, break up the scar tissue, but now it's a little loose, and so we may have to do something like dilute Radiesse. Some patients even need a facelift or potentially a face tight, where you go inside, heat the skin, contract the tissue because of how much laxity was there. So if there was like a long-standing anchoring of the skin, it's really pulled down, you may have to do other treatments. It's not just about really doing just subcision by itself. You have to combine it with something else, and maybe you have to do something with like skin tightening, for example. What are the best tools for subcision? Well, a good question. So a lot of times I mostly use blunt cannula for subcision. So blunt cannula usually works best, but sometimes you may end up needing some tools like a Noker needle is probably my next go-to, especially if it's more superficial that we have to just break up some of the scar tissue underneath there. But sometimes we also have to use something like, a lot of times what we have to do for like very deep, thick scars, intradermal scars, we may have to do something where we use talar liberator subcision. So that actually is something where we go inside and actually break up that scar tissue really well. And that's something also to consider, that we may have to do talar liberator subcision as well. Go inside and actually each of those individual bonds that are really stuck, break it up really well. Let's see here. I saw a few other questions here. Where was I at? Retinol can help improve acne scars. It can help somewhat with some of the oil production for scars. Not going to help enough though for the vast majority of patients though, to be honest with you. It's going to help with like potentially with some of those ice pick scars, help with the diameter of the scar. But really it's for like these deep scars, really not going to change too much with those, unfortunately. Does the consultation cost go towards treatment? Yes, you basically could book it directly on our page, drqazi.com, and then that'll actually just go towards your treatment as well. Let's see here. Jesse Beatrice is saying, hello, I'm interested in doing subcision and Bellafill. Would that work on texture? Well, the subcision will help stimulate some collagen production. It will help break up some of that scar tissue inside there, lift it up. But the texture really is more with a laser. So you want to resurface the scar itself, and that's going to really involve lasers or peels to do that. Texture is more of resurfacing. But Bellafill is going to really like support the scar tissue a bit there, give you overall like some collagen, which is going to make the skin quality look a lot better. But you may still feel like there's still some thickness around the edges of the scar. It may still feel a little bit rough. And that's where really something like that really you do want to make sure that you use a laser or some sort of energy device. Where am I located? Yes, I'm over in Newport Beach. Hi, user. How's it going? Good seeing everybody on. Sorry, I think there was an issue with one of the platforms over here, so hopefully it'll log back onto it. I'm getting plastic surgery on my body. Is it advised to get CO2 laser after or during recovery? It's a good question. I mean, it depends on what part of your body you're doing it on. If it's like your back and you have to lay down face down, then probably not. But if it's front facing, then yeah, probably it's okay. The truth is that we could do that in combination, and it works out pretty well because while you're recovering from surgery, you could also be recovering from the laser at the same time. That's perfectly fine, actually. Melly Elephant is saying, does subcision make tethering appear because it tries to repair itself from the subcision? Good question. You mean that you get new scar tissue that forms due to the subcision, which then gets tethered. It's tough to say really if that's ever really, I've seen any consequence of that, even from people that have done it elsewhere. I haven't been able to tell somebody that this is new tethering that occurred due to subcision, but I think that it'll be really unlikely because vast majority of people do it with a lot of tumescent, a lot of numbing solution. There are some people that do it, and I see it sometimes where they're going in there just and it's really, really bloody the way they're doing it because they actually sometimes want to trigger like they actually want to actually get a lot of bleeding over there. They think that hematomas are actually beneficial, and then yeah, you may end up getting some new scar tissue that way, and then potentially that you have to break up some of that new tethering that's occurring there. But unlikely, the vast majority of times, most people are going to try to make sure that they put a lot of volume in there, meaning like numbing solution in there, and then you could glide really nicely, so less likely of an issue. And you really want to always make sure that you're in the right plane as we're breaking it up there. Confetti is saying, if someone needs more than one subcision, are they just not getting the treatment correctly initially? So it's possible, yeah. Most likely it's because it just wasn't effective that first time, but it's also possible that it was relatively deep, and to be safe, we may not have gone down that deep just because I wanted to make sure that that was even necessary. So here and there, it's a possibility, especially in the lower part of the face, where I have to repeat that subcision. And a lot of times I'll tell patients that it may be a little bit deep over there, and the last thing I want to do is shift fat or cause more problems. So I may not actually go super aggressive in that lower pocket there. But vast majority of the time, it's like, even if I don't go down there, it's still effective enough. It doesn't make much of a difference. But, I had a patient that the other day that I felt that there was still this area down deep, and we'll probably have to go back in there and go at it if it hasn't resolved it completely. Sometimes it happens like that. It's like I have very severe cases, and vast majority of times it's like completely done. We could completely solve those scars. But I always try to balance like that safety profile really with making sure that you could get results. And that safety always really supersedes everything. So I'm going to try to always make sure that's very, very safe for patients. And there's ways of doing it. It's just we got to be really careful as we're working on the skin. And especially when we're doing tools that could potentially be sharp tools like Tailor Liberator, Noker needle, I'm always making sure that my depth is really exactly appropriate. Today I had 3 really cool subcision cases. Two of them were blunt cannula. One of them was with Tailor Liberator. And it was like, his scars were extremely thick, very, very difficult to break down. He had thick, oily skin before in the past, and very deep scars, Asian patient. And I see it a lot of times where it's really, really tight in certain areas. And just for some localized spot, we may have to break it up a bit with Tailor Liberator. And he saw it was actually really interesting. I don't know if he's on tonight, but basically it was really tough to break through that with the blunt cannula. And then I went to the same spot with a Tailor Liberator, and then I broke that up, and then I showed him afterwards, like going back in with the blunt cannula, and he's like, it's so much better now, it's so smooth, and it's awesome. And a lot of people would say it's really like satisfying, really cathartic for them that they broke that up, that piece that was really stuck for years and years. PK Farnsworth is saying, hi, Dr. Qazi. When doing subcision correctly, do you always hear popping, or does the patient hear, or does it sometimes depend? No, you don't always hear it. It depends on how thick the bonds are. And it depends really also a lot of times in what location we're doing it, what depth we're doing. So if it's sometimes more superficial, we may not hear quite as much of that popping, but like intradermal, yeah, a lot of times I will break that bond up really well. And patients do hear a bit of it. They won't feel any pain, but they may like feel a bit of the tug as it breaks up. And it's pretty evident, like I said, like the patient today, like I went through over and over and over again with blunt cannula subcision, and then finally with the Tailor Liberator, broke free, liberated. So awesome. Actually, I love that name, Tailor Liberator. It was a really good name. Let's see. Do you have any opinion on Sculptra causing scars underneath the skin permanently? Well, I think it's possible that it could cause, it's a lactic acid-based product though, so unlikely to cause for a vast majority of patients. But if it's not dilute enough, there's a possibility that it could form nodules. I had a patient yesterday actually who had gotten Sculptra done elsewhere, and they did probably a little bit of like too thick of a formula in the lower part of the face, and it caused a nodule there. So that's tough because, I looked at it underneath the ultrasound. You could see the Sculptra really clearly with the ultrasound. But really a lot of the swelling was also due to some collagen production around it as well. So there's a few options that we could do. Sometimes you could do steroid to help reduce some of that collagen. Sometimes you could excise it if it's in the right spot. Depends on really what we're looking at and in what location the Sculptra is. So I've had patients, one patient, she went to a dermatologist that was in Beverly Hills, and he had done Sculptra right over here, and she had a bad nodule from that, and that was a tough spot because it's not something you just excise, you could just cut away. But actually using lasers did help with it. Using a little bit of steroid did help with it. So that actually did improve it quite a bit there. But I had another patient actually, and they had done it over in like, someone had done it in the same person actually had done it over in the eyelid area. Another person had done it in the bridge of the nose. So a few issues where like it shouldn't be in those spots really. Sometimes actually underneath the eyes too, I've seen too. That's another place that you definitely don't want to place it. It's not even, there's no question. You really should not be placing it underneath the eyes, because over time, it's a product that doesn't break down as easily if it's injected in a certain way and it's really too thick. And then it could end up being that essentially it leaves this nodule, and underneath the eye nodule, really tough to get rid of now. Do you need to laser the entire face, or can you just do specific scars? I mean, actually leave it up to patients, really. So patients will tell me if they want to do the full face or the scars. I mostly do like a blended approach for like the areas that I'm working on, because some areas I have to go pretty deep with the laser sometimes. If it's like deeper boxcar scars, I try to level the sides down closer to the base of the scar. And then I get it so that the rest of the skin is pretty evened out there. And then if there's no scarring on the forehead, I'm happy to do it for you still if you want it there, or like the nose or the chin or the upper lip or whatever else. It all depends on what you need or you're requesting. If you want it for more like anti-aging purposes, then yeah, absolutely we could do that there. But everybody's different, and some people will request it, some people won't. And I'm fine with doing all those areas except for just around the eyes. I just make sure that that's treated a little bit differently. User 10 is saying, filler for very slight volume loss on inner corner of the eyes. What type of filler? So for inner corner of the eyes, you just really have to accept it, unfortunately. Not a good spot for filler at all, so I would not do filler in that area. So don't do filler there. Inner corner of the eyes, just accept it's part of the aging process. Everybody has a little bit of hollowness there. It happens. Just don't do anything there. If during TCA you use laser or CO2 laser for some scars, is a price for both CO2 and TCA? I guess I'm missing the question here. What is the price difference? I guess you have to repeat that question. I missed that question here. Can a scar grow new skin from an ablative Erbium YAG laser? Can you get new skin after you smooth down the scar? Yes, you definitely could. But it doesn't necessarily have to be ablative, like or fully ablative laser. It's not like accurate. You don't have to do fully ablative lasers. Actually, vast majority of people do not need fully ablative lasers. Really, you could actually go a lot lighter than you may expect. It's a lot of times people actually go too harsh with some of these devices. It's too much energy, and instead just do a blended approach. But that being said, it actually could take a while still, for you to recover. Everybody's different. Asian skin tone could take a little bit more time. Follow the instructions. I will say there's some people that just don't follow the instructions sometimes. I say to do these things, and it takes them longer. But if you follow the instructions, it's like, we're going to get you through this. We'll be able to get you through this whole process from start to finish. I do the scars really start to finish. And it's like, there's no question that we could be able to get this like over and over and over again, an excellent result. But sometimes you just have to just be patient. Like, and a lot of actually, I should say a lot of times, these patients, when I show results over and over, I'm showcasing that these are 3 months out, these are 6 months out, these are a year out, these are a year and a half out. It's on purpose. I'm not showing you like a week later on purpose, because a week later it looks awesome. And then really kind of like the first 3 months, it may not look that great. Actually, it may not look like perfect. It takes a lot longer to improve now from there on out. And it's like your collagen has to get produced. You are going to start noticing that your oil production is going to fluctuate. After you do a laser treatment, you get more oily. There's just no way around it, because you're dry and your body wants to produce more oil. So what ends up happening is that people may feel like their scars are a little bit dilated during that process. It's a little bit wider. And that's normal. That's like happens over and over again. The ways to solve that really is to control your oil and also control and moisturize a lot. So we do that. We showcase how to do that. But there's some people that will just choose like some random type of creams and things like that, and they can run into more problems that way. It's just you're not gonna really get to that result. You may not get enough collagen response then if you do it that way. Let's see here. Jesse is saying, I want to stop by and get some procedures by you, but I work with people. I need no downtime. Well, you could always do things like TCA cross if you have ice pick scars, which don't have much downtime. If you have volume loss, then you could do something like Bellafill. All those could be options there for you. You don't necessarily have to do lasers. Do acne scars ever fully disappear? It depends on the depth of it. It's like, visually it could, it looks like it could. So yes, sometimes it could disappear, but it depends on the depth. But if it's, relatively deep and there's really a lot of thickness around there, it's not going to disappear completely, but it still improves enough where it's not as visible to most people. Silva is saying, Doctor, can tretinoin help with redness post-laser CO2? Good question. Tretinoin will be helpful for the oil production, but you definitely don't want to overshoot it because that could actually prolong redness as well, because it could end up overly drying the skin. So there's going to be like this fine balancing act. I do like a very light form of retinol afterwards, and then we could escalate it a bit to higher forms, and that's mostly for like oil control, but not so much for the redness. Redness, a lot of times after laser, just means you got to moisturize a lot more. That's like new skin, do a lot more moisturizing. Let's see here. Can Subcision tighten the skin? Not exactly. No, it's not going to really tighten the skin by itself, but like some patients will have like where it's tethered and stuck and pulled down a bit. And you have to go in there and manually break up that scar tissue, because what ended up happening is that it stretched out the skin around it. So the area was pulled down, and every time the patient was smiling, it was stretching out and getting looser. And so when that happens, you break up that scar tissue, lift it up, and now there is going to be an effect where you no longer have it as loose around there, because over time you're not causing that damage and you're not causing that mechanical injury to the skin. But it's not going to by itself like just be enough to help with laxity, which I was referring to earlier, that sometimes you have to do things like dilute Radiesse can work very well for skin tightening. It helps with stimulating elastin, and it can help with that. Does liquid subcision work? I had an injection that is supposed to create collagen and break scars. I'm not sure what you're referring to by liquid injection. Are you talking about numbing solution of that? Is that what you're referring to? Let's see here. MD saying, I did a big combo treatment and got infected in the flight home. How can that be avoided? MD, it doesn't sound like you're one of my patients, but we always do a few different things. We do, when you're flying back, you'll have a special mask to help you, and that's going to help you stay clean. On top of it, we use topical antimicrobials, oral medications as well to help with preventing infections. Okay, MD saying not my patient, but those are things to do to avoid it in the future. Most of our patients are out of state and they fly back and there's no problems. So there's ways to really protect the skin afterwards. Kim Noor is saying, I have scars and spots. My oil is mixed too oily. So the main thing is to start with that oil production, really. Start with us. Start with oil production, and maybe with like a topical retinoid, potentially with like oral Accutane or Accure laser. So all options really to control oil production. Are Saturdays possible to come down? I'm in San Diego. This year, I'm doing way less Saturdays, It's like there's a couple that are on for the year, but I really limited it because I wanted to make sure I had enough time for family. See, I'm not sure. Like you could talk to my team and see if there's any availability for those Saturdays though. But I did do a lot more earlier on in my career, and now it's like I really wanted to make sure that I could have enough time for them. So way less likely, but it's possible. If you request it, there may be a day that they have that they say, yeah, that's the day that I'll be available. And I said I could do that day. Let's see here. SB saying, if during TCA use CO2 laser to level some scars, is the price for both TCA and laser charged? Yes, we would do TCA and laser that day. Correct. That will be both laser and TCA that day. And appreciate you, MD. Thank you so much. Let's see here. Shocked is saying, hi, sir. I am from India. I have scars last 2 years. I did 3 sessions of microneedling. I didn't get an improvement. What's next procedure to do? It depends on what kind of scars they are. It depends on how deep they are. Microneedling is for a vast majority of scars not particularly too helpful, though, to be honest with you. Let's see here. Vinith is saying, hello, doctor. What are the best treatments for lifting cheeks that have sagged after subcision? It depends. If it really is true sagging, you may need to do a facelift. I'm not sure if that's what you're referring to. It's like true sagging. If it's just from aging process, tough to say. If they'd used other fillers or other anything else at the same time they did subcision, that could cause it to get lumpy, and that could cause that to pull down a bit there. So I'm not sure if that's what you're referring to, but let me know. What exactly happened to you when you ended up doing it, or if you're just concerned about that. Let's see here. Where was I at? Where's our office? Our office is in Newport Beach, California. Where was I at there? So does subcision cause sagging or just tailor techniques? I mean, if you're kind of cavalier with any tool, it could cause that. It's not really just about like they're using a tailor liberator. It's not really like a matter of like only if you're only using blunt cannula. Blunt cannula could also be dangerous too. You have to be really careful and mindful as you're doing blunt cannula too. Never just going in there just like using it like a windshield wiper type of approach. So I wouldn't do any of those type of things, honestly. So just to be clear, it's like be really careful with whatever you're doing, and really make sure that you're in the right plane really, really carefully, and slowly really breaking and releasing those bonds. Let's see. Kinmore saying, I have scars and spots. My oil is mixed to oily. What can I do, please? So yeah, that's what I was referring to earlier. Just control that oil production first. The biggest thing is control oil first. Start with that, and then eventually we could work on more of like your scars, and you're going to get a more robust collagen response. Dina is saying they went to a doctor, I'll skip over the name there, that ended up causing sagging with their tool, and what can be done. So, I've seen a few different issues with that happening before in the past. Sorry that happened to you. And yes, that particular physician as well, I've seen that happen. And I'm not entirely sure what this tool is that he's using, and to be honest with you. I think it's the same thing as the tailor liberator. He says it's like patented, but I'm not sure because it's like, I'm not sure really, because it doesn't seem like it really is. But whatever, either way, sorry. And I've had a few patients that have had that issue, and they said the lower part of their face it happened, and he went to probably too harsh there, and potentially displaced some fat pads, and ended up causing problems. And like it's been happening a few times. So I'm not sure why that happens, but I'll be happy to help you. I'll take a look and see, there's different options that you could potentially do. One of the patients that was on here a few weeks ago, she had commented that I had worked on her a month or so ago before, and she had actually the same issue as you. And I ended up doing some subcision, and it actually did improve that bit of laxity that she had. We also did help actually with the laser there, working and contracting the tissue there as well. So that all improved things, but it's tough to say without knowing, specifically how much of that sagging did occur for you. And again, sorry that it happened. And I do feel like there are some people that are pretty reckless with the way they do it. And they want to make it seem as if, they're the experts at certain things, and, braggarts a bit about this. And unfortunately, I've seen over and over and over again, those same people have done like more reckless procedures and things that are a little bit risky for people. So, hopefully, there's things that we can now push and try to showcase that there's a way to do this safely, and get this so that people know that if you're really careful with this, we can get a beautiful, excellent result for you. And that's the thing. The best way to avoid sagging, someone's asking what's the best way, is to watch how people do it. Watch the thing. If you're not comfortable with it, fine. Go somewhere that you feel comfortable with if it makes sense to you. And the way I do it, I find is very, very safe. It's very controlled, very careful. Going in meticulously, breaking up that scar tissue at each individual spot works incredibly well. But you'll see some other people, and they go really, they just go jump in there with something like a tailor liberator or tool. And that same physician that you're referring to, some people have said that other doctors have done their, have done it on them. They didn't even know at the time that somebody else was just going to work on their face and stuff. They were signed up for one doctor, another doctor ended up doing it. But I do my scars start to finish, really. So it's like I let everyone know, I'll do it completely. With you, and you're completely in my hands. So it's like from my responsibility from start to finish, and I'll help you out with that way. and we'll make sure it's like a consistent, safe result over and over again. Let's see here. Do you know a good dermatologist in Portugal? Unfortunately, I can't off the top of my head right now. As is saying, is Tailor Liberator not good? Is it better to use blunt cannula? I think there's very, very few people that you should trust with Subcision in general. And then certainly with sharp tools, I think there's very, very few people. And even the people that you may think that are people you may trust, maybe you should look into it and double check to see, what's going on with that and the quality of their work. So I'll leave it at that. I mean, I think that a lot of people know, what's going on, and a lot of people just didn't really realize that there was, for a long time, that there was this complication with Subcision, and they sort of accepted that like this person was going to be like careful with them. And you'll hear over and over that the doctors that they went to were not careful. They seemed like they were rushed. They seemed like they were just like, pushing things and stuff like that. And it turns out like they ended up with severe consequences afterwards. And, it's unfortunate. It's unfortunate that it happens over and over and over again. So hopefully we could change that. Hopefully we could change that whole thing. And Confetti saying, I appreciate you not gaslighting sagging. Yeah, I mean, I think that there's always consequences. Anytime you're doing any type of procedure, invasive procedure, there's consequences and risk. So it's important just to pay attention to the possibilities. And like I always think worst case scenario and then just work my way down. And so it's like just think like worst case, what's the worst that could happen, whatever you do. And then like, okay, how can we avoid that and how can we treat that? All those type of things. There was one last question here. Charlie had a question here. Let's see where Charlie's question is. I missed it actually. Where did it go? Charlie, if you could repeat your question. I know that you were asking a few times to see. So let's see here. Anna's saying, so a linear scar in the glabella region can be completely gone if it's resurfaced and lasered. No, it's a really tough spot to do actually. Linear scar, glabella, really difficult to actually work on because that's a spot that you may end up finding that there's a lot of contraction over there. You want to do Botox over there, and it takes a few times to actually solve that there. And boxcar scars, those usually want to undermine a bit, put a little bit of volume in there, and that usually helps out pretty well there. So that's typically what I end up doing with that. Charlie's saying, hey, Dr. Qazi, how do you decide whether to use Sculptra or Radiesse on a patient? Also, would this help for rolling scars? So good question. I do, for more severe volume loss, I would prefer more like Sculptra, typically because it does give you a little bit more robust volume. But if there's some laxity, that's usually when I would do something more with like Radiesse, because Radiesse does stimulate elastin really well. And a lot of times we want that for patients with scarring when there's areas where it's pulled down really tight and you can see that there's a little bit of laxity around the scar. And so afterwards, we want to put a little bit of that Radiesse in there to stimulate elastin and collagen production so that over time the skin quality continues to improve. But we also can combine that with lasers to get a little bit of skin contraction as well. All right, guys, appreciate everybody on tonight, and I will see you on tomorrow. Let me keep those questions going. I'll keep on answering them. This is a really good question that I saw. I see it over and over again. So hopefully